Good afternoon. I'm Linda Seacrest, and I'm one of the founders of Grokking Wholeness. And we are here today with three of our other members, but we are focusing on Dr. Carol Roberts, who is a functional physician in Naples, Florida. And we have Bob Steritz to my left, I assume, and Douglas to my right, who are also founders of Grokking Wholeness. So, Carol is going to talk to us today about the importance of functional medicine. Take it away, Carol.
Well, thank you, Linda. And I just want to explain what is functional medicine. I really don't like the term
Oh,
because in medicine, it's not your fault. It's Jeffrey Bland actually suggested that, and he's a PhD, not an MD. And functional in medicine means psychosomatic. It's a derogatory term that doctors use. Oh, that's a functional complaint. It
oh,
isn't real. And so when he suggested functional medicine, because he's so famous and so smart, everybody kind of jumped on board. But my favorite term for it is good medicine. It used to be called holistic. It can be called integrative. It can be called complementary, and many names for it. But basically, it's root cause medicine. It's looking for the cause of an illness rather than simply treating symptoms. And I suspect our audience is well aware that conventional medicine is all about treating symptoms and keep you coming back. They don't want to cure anybody. Cure is not a word we're allowed to use in med school
mm,
because if you do, you've lost a customer.
Wow.
What you want is to keep them coming back for their medication renewals. And, and that's how doctors are trained. So once I graduated medical school, I was a surgeon. And being a surgeon kind of shields you from that model. But what I did start to notice was that my patients kept coming back with the same problems. I wasn't curing anybody. The little kids needed their tympanostomy tubes to clear up their middle ear problems. The sinus sufferers needed their sinuses cleaned out from time to time, and so on and so on. And it took me really the better part of 10 years to figure out that I didn't have the tools that I expected to get from a medical education. And worse than that, people were coming back to me and saying, "Oh, I don't have my sinus problems anymore. I went to a chiropractor or I went to a nutritionist and they told me not to eat this or that." And suddenly my problems were gone. So I was mortified because how come I didn't know that? Why didn't they teach me that? And why didn't I know? I'm supposed to know everything. Well, lo and behold, I didn't know everything. So I set out to learn what I hadn't learned in med school. And here I am, like 30 years later, and I'm just beginning to know what I need to know. But I'm getting better at it, and I'm really serving my patients better than I ever could. So that's it in a nutshell. So
Carol,
what,
could I ask you a question?
sure.
You mentioned functional medicine and integrative medicine, and that they were more or less synonymous. What about holistic medicine? Is that part of the same thing?
It's better even than either of those things because functional means it has a very specific um, definition. Basically, you're working on improving functionality, whereas holistic medicine takes that patient in its entirety and in context and in every level, every dimension that a human being needs to function in. So it's not just physiology and foods and basic stuff like that. It's also how do you interact with your environment, your social group, your spiritual beliefs and how do they impact your health. So really holistic is my favorite term for what I do because I do not confine myself to testing and recommending supplements. That's just not enough. Thank you. Great question.
I'll follow along with that question. Even the term medicine, I'm a licensed mental health counselor. I consider myself to be a healthcare professional.
Mhm.
What I do, working with the thinking, the feelings, the lifestyle, and all that, I consider that to be part of healthcare. So, does the term medicine thrown into this functional medicine, integrative medicine, holistic medicine, does that preclude other specialties that has to do with the mind, has to do with the psyche, means soul? I mean, does that have preclude other
So how
uh,
did we get here where we have put ourselves in silos? You do mental health, I do physical health. Why not both of us do both? I mean, I've treated so many people with so-called depression who actually were hypothyroid. Do you know how to recognize that? That would make you more holistic. If you treat hypothyroid, the depression lifts. And so does the insomnia, and so does the weight problem. So yeah, we can't just piecemeal treat people. We either need to treat them as a committee or we need to know everything. And we can't know everything. So I would love to work with a practitioner like you, that where we could ping pong somebody or sit together and listen to their stories and come from our points of expertise and integrate that.
Do you see that model emerging around you locally or in the country? Is this
No,
happening?
no, I do not. I think we're still very much siloed. I
Wow.
mean, there are practitioners who are recognizing that they're not seeing the whole picture. And so hopefully they're finding somebody with a complementary expertise that can put it all together. What I would love to see is conventional doctors recognizing that they need some input from the holistic community in order to better serve their patients. I
Well,
don't
I'm
know.
going to ask a question then. My brother who has a heart condition, he was in California and he was going through Kaiser, and he was up to 11 different drugs, and they finally took him into the hospital where all of the doctors were, and they all sat, as you said, in committee. And that was the only way that they found out that he had the heart condition that he had. They blamed it on everything else because they were fragmented. One was treating this, another one was treating that with a different kind of drug. So that committee thing definitely works. The other thing I want to say is I know from interviewing doctors over the years that they all go back to their alma mater for their classes that they have to take to keep their license. I think it's every 3 years that they have to do that.
Two in Florida.
But if they're going back to their alma maters, they're not learning anything more than what they would learn in conventional medicine. So, how did you learn what you needed to know about holistic medicine, how to approach that?
So I'm kind of a unicorn. I'm an Aquarian. And if you know anything about astrology, Aquarians are the avant-garde of the zodiac. And we're always 20 years ahead of everybody else. And so when I found out that my patients were getting more help from chiropractors, nutritionists, and health food store personnel, I decided I was going to go and learn that because I needed to know it. And to me, it was a question of integrity and how to best serve my patients. So I've been learning ever since. If you get out of medical school, you put that MD on your wall. I call it the magical degree. Then you think you know everything and you pretend to know everything. But over time, you must recognize that you don't know everything, that indeed the patient knows a lot more than you do about what's going on with them. And if you ever hear a doctor say that, you make sure you go back to that doctor because that doctor has humility. Humility is not part of the curriculum, and it needs to be. We're serving the patient. And if we're not using an expanded toolbox, and an expanded view of what that human being represents, who's bringing you their suffering, who's trusting that you will help them, then you need to admit it and send them to someone who can. Would you agree, Douglas?
Oh, absolutely. We have that specialty. I will not work with couples because I am not trained in couples counseling. That's a specialty. And that turns into a pathology too that has physiological consequences. So, yeah, Bob, you were going to say something. I can see you're ready to talk.
Is it that obvious? Yeah, I was listening to Linda's question earlier about her brother. And one of the things that it reminds me of is this thing that doctors have to follow called standard of care. I recently visited a specialist, a urologist, and he wanted to treat me based on what a typical patient would present to that specialty on the first office visit without really any regard to my particular situation. The fact that I had a parathyroid problem that caused issue with too much calcium in my body, which led to all kinds of other symptoms. Um, it seems to me that while we're talking about some of these things, the whole issue of standard of care that most physicians follow is a real problem also. Perhaps you could elaborate on that.
Yeah, well, when I first heard that term, I was a baby doctor in Brandon, Florida, and I was baby doctor, meaning I was in my very first years of practice. But when I heard it, it gave me chills
Hmm.
because there is no standard that fits everyone. And it precludes the art of medicine. The art of medicine is serving the person in front of you. So let me give you an example. Linda, you were talking about your brother.
Yeah.
I don't know your brother, but I know that the heart is much more than a mechanical pump. In fact, the heart is the bioregulator of the entire body,
Mhm.
both physically and energetically. It has a huge, powerful energy field. Now, going to the holistic model, we have to look at the physical. Okay, maybe there's, some dead tissue there. Maybe there's a blockage in one of your arteries. Maybe there's, something that can be fixed. But maybe there is an emotional wound that started this whole thing. And again, I don't know your brother, but I would look at his personal history, his love history, and see if maybe from childhood on, there may have been repeated insults and injuries on an emotional level that need to be addressed and need to be healed. Because the heart is not just a pump, it regulates the whole emotional body as well as the physical, and it connects to the spiritual life as well. So it's not just testing and treating and putting in stents and giving meds and all that. There's far more to the heart story than the standard of care would admit.
Well, who determined or what determined the standard of care? Who does that? Where does that come from?
It comes from the boards, the the American Board of Cardiology, the American Board of Surgery, the American Board of Urology, and based on the published literature, they put out a list of, well, this is the standard of care. If you've got a urinary tract infection, we test this, this, and this. We give you this, this, and that. And then we test again. And then if it's not fixed, then we do the next thing. It's an algorithm that's if this, then that. And if you're a 90-pound grandmother, you get the same treatment as a 250-pound linebacker because that's the standard of care. And the doctor doesn't want to be criticized, and the doctor doesn't want to be pulled up in front of his board of regulators or hospital administrators or whoever. So, yeah, it's the published literature and this small group of doctors that determines what is the standard of care.
Let me ask you a question about that. Maybe it's a myth on my part and misunderstanding. Do you think that standard is more influenced by the insurance companies, the money factor in that, the standard of care, or not? Just my
Well,
thought.
I indirectly, yes, but I think it's more influenced by big pharma
Oh,
Yeah.
because
Okay.
medical education is completely controlled from day one. I remember going to medical school, and before we'd had our first class, we were introduced to a pharma rep, a Lilly representative, who gave each of us a black bag with a stethoscope, with an otoscope, with an ophthalmoscope in it, with Lilly in gold letters on the bag. And, I didn't know anything, and I thought that was really nice. But that's just the beginning. There is no end to interference from pharmaceutical companies throughout the entire medical career, including the continuing education, which is all subsidized by pharma. And no doubt they're paying off the standard of care people, and they pay off the hospitals to include their drugs in their pharmacy. So yes, it's pharma, and then the insurance companies have a lot to do with it. They're all in bed together, and the patient is the one that suffers
yeah.
Yeah.
because they don't have an array of possible treatments. They've only
And
got
the
the
lobbyists and the lobbyists and our Congress peoples and all that, just weave them all into it. Yeah.
money. It's about money.
Yeah.
Yeah, I guess that precludes there's a lot of cures or alternative treatments that are not promoted because there's no money in it for the drug companies.
Absolutely.
Exactly, exactly. And doctors who have been demonized and their reputations have been ruined, and their simple cures are never allowed. So from Dr. Semmelweis back in I think it was early 20th century or late 19th century, who suggested that doctors wash their hands before they examine pregnant ladies having just come from doing autopsies on people who had died of infectious diseases. And he wound up in an insane asylum for his trouble. They wouldn't do it. They wouldn't take responsibility. It's shocking, but it still goes on today. Yeah. So let's get on to happier topics.
Thank
So what one of the things about holistic medicine is that it includes more tools than just drugs, surgery, and radiation. So homeopathy is one of my favorite things. Homeopathy is a type of medicine that relies on incredibly diluted, serially diluted natural substances. And the mantra is like cures like. So, for example, In homeopathic medicine, one of the things you might try for insomnia is coffee cruda, so which is the Latin name for raw coffee. What does coffee do? When you drink coffee, it makes you alert. It keeps you awake at night. So the multiply diluted preparations of coffee neutralize that symptom and can help you fall asleep.
Wow.
It's also incredibly safe. It can be given to babies, it can be given to little kids, it can be given to old people. It doesn't interact with medications. So I love to use it. But these days, homeopathy requires a relatively clean physiology in order to work. And
Mm.
most of us are so toxified that homeopathic remedies don't work anymore. But we can start with detoxification in incredibly sick people with homeopathic remedies. For example, there's one called Nux vomica, which is from a tree nut that would make you throw up if you ate it. So, in homeopathic dilution, it can neutralize symptoms of toxicity. So it's a really good place to start, a safe place for very toxified people. So that's just one thing. We can get into others if you wish.
Well, I carry in my purse now what you carry that I think it's pronounced oscillium or something. It's the homeopathic. If I
Uh,
feel something coming on, I take that. And I think it's great because it usually nips whatever it is in the bud.
there are several remedies that can do that. Oscillococcinum is one, and that's generally used to treat early symptoms of the flu. But Aconitum napellus is another one. And I like to use ivermectin,
Ah,
which
yeah.
is the horse wormer that was vilified during COVID because it works. And anytime I start to come down with something, I'll pop an ivermectin or an aconite or an oscillo, and it almost always goes away in a day. So there's no need to suffer. There's no need to go to the hospital. When they put out their guidelines for treatment of COVID, and they said, well, just give them Tylenol and send them home and tell them to come back if they can't breathe. I was horrified because I didn't sign up to not treat people. And so I started using ivermectin and homeopathics and vitamin D and all this stuff. And not one of my patients ever needed to go to the hospital. So we know things that should be in common use. But because of the standard of care, because of the fear factor, they're not. It's not allowed, and most doctors don't even want to know about them.
I'm
But
sure.
people can do it. People can do it on their own.
Yeah. Yeah, I'm sure there's a lot of people who would like to try alternatives, but are literally are afraid to go against their doctor's wishes. In the case of ivermectin, for example, when somebody's being treated for cancer, I mean, since there's been over, I think, 4 billion doses of ivermectin that have been given since it was first approved as a treatment, and nobody's ever gotten really sick, let alone died from taking ivermectin. Can it hurt if you're taking ivermectin while you're also be treated more conventionally for cancer?
On the contrary, it actually makes those chemo treatments work better. So if there is a conventional oncologist out there who may be clandestinely listening to this podcast, I would invite you to get in touch with me. Please, let's treat together. Let's do this together because conventional chemotherapy is horrific for people. There are much better ways, and even the chemo can work better in concert with ivermectin, which has about 15 different um, mechanisms of action on cancer of all kinds. It can turn around stage 4 cancers, lung cancer, prostate cancer, ovarian cancer, glioblastoma, leukemia, you name it. Please listen. If you're a cancer patient, ask your oncologist. Get on the internet. It's all over there on Substack, which is one of those apps that is not currently being censored, and learn about ivermectin and fenbendazole, both of which we give to our dogs every month for, worming and flea prevention and all that stuff. And they've been time tested. In fact, everyone in Africa, or many people in Africa, take ivermectin to prevent malaria. And that's why the COVID incidence was so low in Africa. Nobody knows that, and nobody looks at that. But there it is.
In our website, we talk a lot about consciousness. There's the plant-based medicines. We've talked about this amongst us, that's making, it's really making a profound impact on people's lives, helping people. Is that part of the functional medicine or the integrative model? Also looking at the help in raising or altering our consciousness? What's the role of plant-based, what would you say, helpers or medicine?
Oh, you're talking about psychedelics? Well,
Psychedelics.
I
Does
think
that
we
have a
don't have
role?
to go there to change our consciousness. There have been multiple studies on, Larry Dossey pioneered
Yeah.
this, on prayer
Yes.
as a therapeutic intervention, and it works. It's been shown totally double-blind, prospective, you know, studies. So is that a change of consciousness? Well, it is, because it's enlisting the consciousness of a group of people to benefit a sick person. On top of that, you can investigate the belief system of any
Yes.
sufferer, help them to translate that to a more helpful, um, pragmatic way of thinking about your illness. How many people have come through cancer and said, it was the best thing that ever happened to me?
Mm.
Well, if you can go into that with that kind of an attitude, why am I having this? What is it trying to teach me? And how can I change my mental state, my belief system, in order to make it unnecessary anymore? So yeah, consciousness is everything.
I taught mindfulness practice to all my clients, teaching them how to regulate their own physiology, how to relax and all that. How I think that's such an important part, the psychoneuroimmunology, that we could change our beliefs, our thoughts, our feelings. It affects our nervous system, it affects our immune system response. It heightens the immune system response. I think that's such a valid part of a holistic system, teaching people.
Indeed.
Yeah, I'd like to add to what you just said. It's my understanding that emotional trauma can be stored in the physical body. And sometimes by treating the emotional trauma, the physical symptoms disappear. Would you comment on that?
Well, I think, I started to with the heart disease issue, because the heart is very easily traumatized, and usually repeatedly. And that can lead to heart disease. So if you can learn your way around the trauma, let it go. Yes, all trauma is stored in the body. Body workers know that. Massage therapists, craniosacral workers, body workers of all kinds. Sometimes when you touch a trigger point, the person begins to cry like a baby. They've suddenly remembered something that happened to them decades ago, and they're able to release it. So with the body is only, it's a vehicle for this life, but it's far from the foundational vehicle. It's consciousness that invests everything. And we must treat all aspects if we really want healing.
I think what you just said suggests that it works both way, that physical relief can affect mental trauma as well as the other way around.
Yes. Douglas, have you seen that happen in your practice?
Absolutely. Absolutely. Yeah, that's a good point, Bob. Working both ways around. Absolutely.
Since I've been writing for the last 20 years and interviewing people, one of the things that always amazed me, at least for a while, then I kind of got used to hearing it, is that most of the people who have gone into alternative practices did so because that practice healed whatever their problem was. I do remember an MD who absolutely refused to go for acupuncture. He thought it was hooey. And his wife kept after him and after him to go because he had a back problem. And so he finally went. And after a number of treatments, it fixed his back problem. And he actually became an acupuncturist after the MD. So it does, if people are open to it, there are some people who you could treat them with the thing that would cure their issue, but they refuse to believe that it's possible. So I think the mental attitude is a big part of the healing process.
Well, you have to think of what they've been through to get their degree. It's grueling, it's expensive. And then when you come out with that magical degree at the end, um, it's hard to admit that you don't know everything. But there's a great big blind spot in medicine today, and that is we're focused on chemistry.
Mhm.
Chemistry cannot explain what goes on in the body. The trillions and trillions of reactions that happen instantaneously in our 70 trillion cells every second of every day. That is not just chemicals bumping into each other. That is a coherent system that relies on energetics and even light. Did you know our bodies generate light?
Yes.
It's
I've seen that.
phenomenal.
Whatever that thing is that you can put your hand on and it shows your,
Brilliant photography.
yes, yeah.
Yes. And every cell, the mitochondria, are generating more energy per pound than the surface of the sun. Yeah.
I think what you're saying is that the body is not a mechanism. It's not like a machine. It's
No,
way beyond that. You know, all this talk about AI being conscious and things like that. Basically, in the human brain, from what I understand, there's, literally trillions and trillions of connections. Each neuron has 50,000 inputs and outputs, and they're not either on or off. It's analog. So they can be partially on and partially off. And, given that incredible complexity, there's no way a computer running AI is ever going to be able to duplicate that. But when people talk about AI, they talk about, well, it's just a mechanism, it's an algorithm. And I think what we're all saying here is that the human body is not a mechanism. It's way beyond that. And, maybe one day when we figure that out, we'll treat our body, minds accordingly. I would like to bring up one other point also. A lot of people who, when they face their own mortality because they have a severe illness, stage 4 cancer or whatever it might be, seem to wait until the last moment before they say, well, conventional medicine is not helping me. I need to try an alternative approach. And of course, my thought on that as well at that point, that the disease has progressed so far that it's really difficult to turn it around at that point. Would you have any comments on that?
I think that when you're faced with cancer, you should throw everything you have against it. So it's fair to do conventional medicine. It's
Mm.
fair to look into alternatives. And it's not fair to be told by your doctor this doesn't work or that doesn't work. No doctors should be telling people not to do something if they really believe that it might help them, particularly something that is so much less damaging than the conventional treatments. So, yes, I don't tell my patients, don't do this, don't do that. I let them decide if they want to go the conventional route, but I'm very happy to add what I know to what they're doing. So it's got to be a team approach and not this is what you must do and you must not do that. That's that's dumb. That's just dumb. If the patient believes it might work, why not let them try it? So again, if there's an oncologist out there who's listening to this, I want to talk to you because we can work together. That would be the best way to go. So Bob is our engineer. So I'm very happy that you've brought up this mechanistic point of view because this is an outdated paradigm. We've got to move beyond mechanical explanations for how the universe works because the universe is a conscious entity and it produces all this magic, all this amazing stuff. And we have not even begun to understand what really goes on here.
I like to think of the body as a miracle
Mm.
because they cannot figure out how it works. And it is. We're all walking miracles. We're not
Yes.
parts that just came together. We're one whole miracle.
Yes, we weren't assembled, we were grown.
No.
And to me, it's just so amazing, when you start out with a zygote, a fertilized egg, how those cells decide to differentiate, and one becomes a liver cell, one becomes an eye cell, one becomes something else. It seems to me that, whatever the blueprint is for how cells decide to become what they are, the influence is far more than just what's in the DNA.
Of course. Can I give you my theory for what it's worth?
Oh, yeah.
Yeah. So I believe that the soul is contained in a tiny and immeasurably tiny point of energy that when the zygote has reached a certain point, the soul enters, and it enters, in my view, through the soft spot at the top of the head. It hits the pineal gland, which contains crystals, and it spreads out like a rainbow into this blueprint that then directs the cellular differentiation. And if for some reason you have to get later in life somebody else's kidney or somebody else's heart, it carries with it the energetic blueprint of that other individual, the deceased individual. And we know that people post-transplant can change their habits. They can change the kind of music they like or the kind of food that they want, or all kinds of weird things happen because a consciousness is underlying that mechanical organ. So that's my theory for what it's worth. And then at the end, it all comes back to this tiny invisible point of light, and it goes back wherever it came from, the sea of consciousness, I
When
think.
does the pineal gland develop in the unborn? I
Oh,
thought the pineal gland developed later in, I don't know.
I know, but again, that's a mechanistic
Yeah.
question. I
Okay.
don't know the answer, probably much later than I'm thinking, but I like the idea of this tiny soul just becoming the blueprint, the human aura, the energy field of the human being. If anybody knows the artist Alex Gray, I
Yeah.
recommend that you take a look at his painting, The Psychic Energy Field, and you'll see exactly what I'm talking about.
I think what you're describing as a soul is what Rupert Sheldrake would describe as a morphogenetic field. It's what gives form to living organisms, and it controls the shape and the function that they take on. I
Mhm.
mean, different words basically describing the same thing.
Mhm. Yeah, I mean, it's just so magical and so miraculous. We have to just stand in awe. The body heals itself. The doctor is there for entertainment while the healing happens.
I don't believe that. I believe the doctor has a piece in this. Don't they really have a piece in the healing?
Yeah, well, wait a minute. If the doctor's there for entertainment, then maybe they should be charging us and not the other way around.
Well, it's a different kind of point of view, but it's humility. You have to have humility in the face of healing. We don't understand how that happens. And
How
very often we interfere with it.
how hard or easy is it to find a holistic doctor or a functional or integrative medicine doctor? Are they all over the place? Do they advertise? Is there a society where they can join, or how do you find these people?
Good question. So if you look hard enough, you'll find them. So I would say that energy medicine practitioners of all kinds, acupuncturists, Reiki practitioners, um, body workers, anybody that's outside the box might be able to help. There is an Institute for Functional Medicine that trains MD and DO doctors and nurse practitioners, conventional people in the broader view. They really teach root cause medicine. They don't teach so much the whole array of tools, but they respect all the tools. Um, where was I with that? Um, Naturopaths are much more holistic. They learn about prescriptions. They learn about conventional medicine. In some states, they can prescribe, in others not. But they do know herbal medicine. They do know homeopathy much more than MDs and DOs. So look in their publications like the one that Linda works for, Natural Awakenings, where these people tend to advertise. And you can start there, ask your friends and neighbors, look for websites. I mean, I have a problem connecting with patients. They don't know where I am. They may be looking for me, but I don't know how to put it out there. So that's a good question, needs to be addressed, and people should not give up looking because I think they can be benefited by an outside point of view.
I think there is an American Holistic Association, which you might be able to find some of them there.
The American Holistic Medical
Yeah.
Association, integrative and holistic. I used to be on their board, and yeah, I think they're still around. Those kinds of websites. Just look up holistic practitioner or integrative or functional, and Dr. Google will take you where you need
Oh,
to go.
yeah.
Carol, what gives you the greatest glimpse of hope right now that things are indeed changing?
Oh, by far the fact that people are waking up. People are looking for this. The patients are looking. It's not the medical profession that's going to change. It's the patients. They're reading about this on the internet. They're watching podcasts like this, and they are asking those questions. So, go to a health food store. They know who the practitioners are. Go to a compounding pharmacy. What is a compounding pharmacy? It's a mom and pop operation that customizes prescriptions. That's not just pill counters like at, the big chain pharmacies where standard of care is practiced for everyone. Compounding pharmacies know who are the doctors in town that are using bioidentical hormones or that are using repurposed drugs or that are using, that are using off-label types of interventions. Nutritionists are great to go to, chiropractors and body workers and energy practitioners. They're out there and they have networks that they can refer you to. So yeah, it's happening. It's happening much more than when I started because again, I'm 20 years ahead. So I'm coming to the end of my career, and I'm very heartened to see that there are a lot of younger folks who are taking up the banner and doing this type of medicine.
I want to thank you all for having joined us for this session with Dr. Carol Roberts. And I want to particularly thank her for answering all of our questions and giving us new information that we didn't know before. And I'd like for you all to please subscribe to our YouTube channel, which is Grokking Wholeness. Is it .com? Grokking Wholeness.
No, Grokking Wholeness with a space.
With a space. And to not only to our YouTube, but also to our website so you can get our newsletter and stay up to date with information because we keep posting for you all so you have fresh information. Thank you.